With the recent decriminalization of cannabis in South Africa, the use of cannabis has become a hot topic in South Africa and around the world. Today we're going to be looking at exactly what the long-term effects of cannabis use are and what it does to us, but we're specifically going to focus on South Africa's public health response to the use of cannabis and evaluating how it's doing. Cannabis is a global phenomenon. Its ability to relax and induce euphoria in the people who use it has made it wildly popular, not just in South Africa, but all over the world. The long-term effects are what we're interested in today, and unfortunately the emerging research isn't as encouraging as you might think.
Studies have shown that cannabis is indeed a gateway drug, which means people that start using cannabis are likely to try other, more harmful drugs. It can also create a cycle of abuse. So we've got all public health issues that need to be dealt with, and this video is going to explore that. We're going to look at what responses exist in South Africa and have a look at how well they're dealing with these challenges.
South Africa is unique in how it abuses substances. The country was deeply affected by the end of apartheid, and once its borders and ports opened, its location and trade links made it an ideal location for drug trafficking. The country has a serious drug problem, as it's been reported as twice that of the world's norm, as over 7% of the population abuses drugs of some kind. Substance use historically has been divided along ethnic lines. Pre-1994, cannabis use was mainly in black communities. However, this is changing as South Africa becomes more racially integrated. The effects of apartheid have resulted in high unemployment and substandard education in many communities. These conditions have created a space in which many young people feel that they need to use drugs, as they need to vent their frustration at a lack of opportunities for empowerment in some way. There has been a huge stigma against individuals who have substance abuse disorders. This has resulted in many people being reluctant to seek treatment due to a stigma associated with the label of addict. In addition, many people feel that rehabilitation is not an option due to the idea that the conditions in these centers are inhumane and even that the treatment may be ineffective.
Cannabis use extends into difficulties in treatment and the spread of HIV. There are reports of an increased cannabis use among those who are HIV positive than those in the general population. Several studies state that cannabis use is strongly linked to STD contraction and sexual risk behaviors. This is linked to the spread and the increased viral load of the HIV population. However, casual cannabis use is linked to high adherence to ARTs and low adherence to heavy users of cannabis. These heavy users are more likely to develop drug resistance, develop AIDS, and have a higher mortality rate within the subpopulation. Cannabis is mostly used for the purpose of alleviating ART symptoms. In addition, some studies have shown that cannabis has the ability to prevent trauma from HIV-related nerve damage, as well as inhibit HIV replication. It's estimated about 37 million people are globally affected with HIV, with about 12.6% of South Africa being infected. This leads to the increasing need for treatment and the use of alternative medicines such as cannabis.
Traditionally, substance abuse services have not been provided in South African healthcare facilities. This has resulted in limited access to treatment. A lack of mental health workers has slowed plans to integrate these services into the health system. This has prompted calls for task shifting of some treatment responsibilities to non-specialty health workers. Mental health issues, and specifically ones to do with substance abuse, tend to generally be dealt with in the specialties departments. Generally, the patient will go from primary healthcare services, and after assessment, the PHC will then refer them to the community health services, where they have a bit more capacity to deal with mental health patients. Should the case be above CHC capabilities, after 72 hours of assessment, they'll then be referred to a psychiatric clinic in the district hospital for further intensive rehabilitation processes. If necessary, they would then be sent to a psychiatric hospital. Only tertiary health services may provide intensive mental health care, and so treatment may not be given for more than 6 months unless authorized by a registered mental health practitioner. There are 3 types of treatment and rehabilitation routes: There's the voluntary, the involuntary, and the assisted care, treatment, and rehabilitation routes. Before admission, mental health care users will have to be examined by 2 medical practitioners who will perform a physical and mental examination. Important to also mention is the power of the courts in mandating treatment. The 2008 Prevention of and Treatment for Substance Abuse Act says the Minister of Health is responsible for the departments and various organs of state under them, and that they need to take responsible measures within their scope of their deputy functions and available resources to combat substance abuse. This Act stipulates that this ought to be done through the development and coordination of interventions that fall into 3 broad categories, namely demand reduction, harm reduction, and supply reduction. This in turn then speaks to the investment in preventative measures.
Having already looked at the primary healthcare system, the South African government also invests in preventative measures. Approaches to the prevention of substance abuse that the government have used has actually impacted the community of South Africa very differently. As a result, the approach to this prevention has changed over the years. There are several organizations that work together with governmental departments as well as committees and forums put in place to work for the prevention of substance abuse. For example, there is an initiative known as the Khulisa Crime Prevention Initiative that focuses on the impact that substance abuse has on crime. The Central Drug Authority is an organization that addresses the issues that children face because of substance abuse. The Department of Social Development, in collaboration with the United Nations Office on Drugs and Crime, also have a campaign that they run known as Kimoja, I'm Fine Without Drugs, that promotes upliftment within communities by promoting well-being and healthy lifestyle choices. There are also other prevention measures that other organizations supply, such as the South African Depression and Anxiety Group, which provides toll-free helplines for people struggling with psychological issues that may include issues with substance abuse. Other measures that the government and other organizations have put in place to combat substance abuse in this country are actually treatment centers for people already struggling with substance abuse.
Inpatient care is, as is the norm globally, the backbone of the public sector's response to those suffering from substance-related issues, though there has been a recent push towards prevention and community programs. Inpatient care is, as is the norm globally, the backbone of the public sector's response to those suffering from substance-related issues, though there has been a recent push towards prevention and community programs. Nationally, there are 24.4 beds per 100,000 people for individuals suffering from mental distress. These beds are most commonly found in mental hospitals, such as Fort England. Substance abuse patients make up a significant but unidentified portion of those individuals suffering from mental distress. This is most commonly due to alcohol-related issues, though cannabis is coming in second at approximately 20%. The average staying period in inpatient facilities for substance-related patients is 32 days, though relapses are common. Inpatient facilities are important because there is a significantly lower dropout rate in inpatient care when compared to outpatient care. The Prevention and Treatment of Drug Dependency Act of 1992 provides the groundwork for inpatient care for those suffering from substance-related issues. It has, however, been updated numerous times, with the most recent major changes happening in 2008 with the Prevention and Treatment for Substance Abuse Act. As outlined in this, there is a compulsory intake assessment for all incoming patients, the results of which must be conveyed either to the patient or the patient's guardian. An individual treatment plan must then be created for each patient. In practice, however, each facility generally has a set treatment plan that each incoming patient begins automatically. Importantly, this treatment plan must be evidence-based. The most commonly reported treatment is group therapy, which attempts to utilize person-centered therapy principles. The second most common is occupational therapy. Medication is at times used in cases of substance abuse, but is typically only used in cases of harder drugs, i.e. not cannabis. Medication is usually only used to treat the psychotic breaks that can occur when cannabis is taken. Inpatient facilities attempt to give a preventative education in an attempt to prevent relapse. As part of this, each inpatient facility has an HIV and AIDS awareness campaign. From inpatient care, most patients are either simply sent back into society or, in a preferable scenario, puts in an aftercare and reintegration program.
Aftercare and reintegration is crucial for an individual who has completed substance abuse treatment and is now in recovery. Aftercare usually involves lower levels of treatment and is offered to individuals who have completed the inpatient care facility. Aftercare provides access to an ongoing support structure to provide guidance to living a productive life outside of the rehab center. An example of aftercare would be outpatient care.
Outpatient care is offered to individuals who are suffering from substance abuse but are unable to take part in inpatient treatment programs because of work obligations or family responsibilities. There are several services that are made available in outpatient programs. Reintegration services aim to assist the clients in reintegrating back into society. One way in which reintegration occurs is through halfway houses. Halfway houses provide a controlled and well-structured environment with the aim of preventing a relapse. Reintegration services allow the client to interact with other recovering substance abusers, their families, and communities. Support groups are also offered as part of the reintegration process.
South Africa is a country with a troubled past. However, the present isn't looking much better when it comes to treatment of substance abuse and response by the healthcare department. Public healthcare is free to all South African citizens, which means anyone can seek help. However, the problem is that they are not adequately equipped to deal with the influx of patients. This is due to a lack of funding within public hospitals, and as a result of this, patient care suffers. The public healthcare system suffers a disadvantage such as long wait times, poor quality care, rushed appointments, old facilities, poor disease control and prevention practice. The length of stay in these public facilities is cut down as a result of lack of adequate bedding. This in turn sends patients back out onto the streets without proper care and leaves them at risk of drug abuse again. There is, however, some benefits that the SA government has implemented, such as toll-free helpline. For all the benefits this helpline provides, however, there is not adequate infrastructure to take the people who abuse. Although there is halfway houses, there is not enough, and with the number of people abusing substances going up more and more, people are left without options. Furthermore, when it is actually time to treat patients, there are long wait times. This is because there are not enough specialists who visit these clinics as they have their own private practice. However, those that do work pro bono often do not have the experience and are working at these clinics to get training. This shows that there is not adequate response by the South African Healthcare Service to try and change the current state of public hospitals. We can also credit pre-1994 to the current state of healthcare. The healthcare budget has been stretched to accommodate all South Africans now, and as a result, the government struggles to make improvements.
Another reason why South Africa's response to substance abuse has not been successful is because they are solely focusing on prevention methods rather than safe use methods, which basically means they are trying to get people to abstain from drugs rather than teach those who wish to use them how to do so safely. The reason we are saying that this is a failure on South Africa's part is because studies have shown that adolescents are prone to do things that adults have deemed illegal or have told them not to do. Therefore, even though South Africa has placed a number of anti-drug campaigns within schools, studies have shown that this has increased the usage of substances amongst adolescents rather than decreased it. Therefore, we believe that South Africa needs to implement more realistic policies where people are made aware of the consequences of drugs, but are also taught safety lessons if they wish to use them. The main way we teach kids about drugs is fear-based, through ads showing teeth falling out and skin going grey. These ads are marketed to minors ages 12 to 18, but this market does not have a fully developed frontal lobe or the part of the brain that understands long-term consequences. Students aren't afraid of memory loss if they smoke weed or bad lungs if they smoke cigarettes because these are long-term effects and they do not appear real. South Africa should stop funding the Just Say No campaigns and put their limited resources into educating the youth about the consequences and safety lessons on drug usage if they ever want to decrease the percentage of substance abuse amongst adolescents.
Looking forward, we can only really speculate about the approach that South Africa will take towards the regulation of cannabis and the steps that will be taken to ensure that the harmful effects of the substance can be prevented. The only way that the harmful effects of cannabis can be effectively reduced is by changing the perspective through which it's viewed. Cannabis historically has been looked at through a criminal justice perspective, but hopefully with the new court ruling, that perspective can change to a public health one. Changing the perspective through which cannabis is viewed will allow for more control and protection for consumers. The public health system will need to adapt its approach to the prevention and treatment of cannabis-related issues. We can probably expect to see changes around how cannabis is spoken about, as well as educational campaigns about its use and the harm that it may cause. Because of the new laws decriminalizing cannabis, it is likely to be more readily available to consumers as more people will be able to grow it. This most likely will be offset by the fact that it is still illegal to sell cannabis, not that that's ever stopped anyone in the past.
Another area that the healthcare system will need to adapt in is that of treatment for those who do suffer from harmful effects of cannabis. The process of treatment may need to become more streamlined as the drug becomes more readily available and accessible. People who may never have used cannabis before may now try thinking that they will be fine and end up reacting badly. The risk is not guaranteed, however, due to the fact that yes, there is the chance that more cases will pop up because of the new laws, but there is equally the chance that government regulations will begin to prevent even more cases appearing. Possibly the most significant change that will come about as a result of the decriminalization of cannabis is the change in thinking and perspective around the use of the plant and the stigmas that are attached to those that use it. While this could, as we mentioned, lead more people to try it and increase the number of people who may require treatment, it could also lead to a removal of that stigma. This means that more people who have a dependency on the drug can come forward to seek help without fear of arrest or judgment. The stigma being removed may also lead to increased funding for the treatment of those who need it as a direct or indirect result of cannabis use. At this point, the fate of the public health-based approach is in the hands of Parliament.